The article I am critiquing is Adolescent Clinical Populations and Associations Between Trauma and Behavioral and Emotional Problems. The goal of this article was to add to pre-existing literature that supports the call to the emphasis of the importance of trauma-informed care for patients in clinical populations. They did this by specifically studying adolescents in 4 clinical populations: inpatient psychiatry, outpatient psychiatry, residential substance abuse settings, and outpatient medical services. Their hypothesis for the study was a greater number of types of trauma would be associated with both higher internalizing and externalizing symptoms, as well as PTSD symptoms among adolescents reporting a history of trauma. The types of trauma they surveyed were limited to 8 types of events: natural disaster, accident, community violence, domestic violence, physical abuse, sexual abuse, hearing about a serious death and or injury of a loved one, and painful or scary medical treatment. Internalizing symptoms were defined as problems presenting in an adolescent's mood or emotion. Examples of this would be depression, anxiety, and withdrawal issues. Externalizing problems were defined as ones presenting with issues of aggression and delinquency and oppositional defiance disorder and conduct disorder. This was completed through a analysis of a cross-sectional quasi-experiment using the self-report-based surveys. Specifically, the surveys they used were the Use Self-Report. There were 94 participants in the study, all who were adolescents within one of 4 of the aforementioned clinical populations between the ages of 13 and 19 years old. Of these 94 participants, 64% were female, 36% were male, 73% were white and Caucasian, and all were from Seattle, Washington. The results did not confirm one specific thing, but did meet their goal of adding to the literature by showing that most adolescents in the study did experience some form of trauma. This leads to the conclusion that, especially for adolescents within a clinical population, trauma-informed care is essential in the service delivery settings. The study could not, however, assess what trauma actually caused greater severity. There were several notable issues with this research study. The first was the study itself claimed that their design was not enough to gain statistically significant data. They only took self-reports from adolescents, which leads a lot of conditional errors that could skew the results. They also claimed that adding a parent's perspective would add to the accuracy and the usefulness of the survey to have some kind of comparison point. However, then additionally, they say that they don't have an accurate way to compare the parents' trauma responses to that of the child's trauma responses. The second problem in this was that the PTSD research they were conducting wasn't really relevant to their experiment at all. They were studying behavioral and mental disorders being issues stemming from trauma, so PTSD could have really been studied as well as one of those, but just under the umbrella of the internalizing and externalizing issues instead of its own separate exploration. This is further validated by the examiners admitting that they learned no additional information in this regard when they were examining the PTSD in these adolescents. So it really neither added nor subtracted from the final results regarding the internalizing and externalizing problems of the adolescents in the clinical populations. This study cannot also be deemed statistically significant because, for the third reason, it would be the sample that they used was not diverse enough for the topic studies. This population was predominantly white and predominantly female. Additionally, out of the 4 clinical populations they studied, the number of participants taken from each clinical setting was statistically significantly skewed. The number of patients studied in outpatient psychiatry clinics and residential substance abuse centers were 30 patients, but for inpatient psychiatry units and adolescent general medical clinics, it was only 24 patients and 10 patients. with that and the lack of diversity, it also added to skewing the results, because different demographics may experience more trauma or may also be less willing to report it. The study did concede, for example, that other study shows African American adolescents experience traumatic events that lead to imposing, internalizing, and externalizing symptoms. So with this experiment being 64 patients being white and Caucasian to the 2 African American adolescents in the study, it shows that it's not representative of that demographic at all, and therefore can't be generalized to reflect a larger population that includes that demographic. So part of the study's purpose was to add to the literature, and for their specific sample of individuals they sampled, they did add to the argument that trauma-centered treatment can be important for adolescents, especially those in these specific groups of people. However, their study is subject to errors from self-reports that could be accounted for by adding parental accounts of their trauma, if there can be a way to find out how to compare the two. And it can't be considered statistically significant across demographics because their sample size was not diversified enough to be largely representative of that.